think that one of the big things that I see with those patients that have, cyclical migraines or just fluctuations with their cycle in general, one of the biggest things that we tend to focus on first, and kind of to your point, is their blood sugar regulation.
Oh yeah, that one too.
And how much that affects their endocrine system.
Yeah.
As well as their like cortisol panels and their sleep-wake cycle is a huge thing, right? And we look at some baseline hormones with patients up front, but if we need to like dive in and we've, really gotten the neurological piece under control, they're doing what they should be doing with their nutrition and all of that kind of stuff. If we're still seeing that cyclical aspect of things, and it's like that's when they're getting their migraines, then we'll dive in and do a little bit deeper look into what's happening with all of the sex hormones, and are they, converting things appropriately, because you may be just misconverting estrogen.
Yeah.
Right. Or you're not having good methylation pathways. So then, you see downstream effects to some of those estrogens and,
Yeah.
So
we
typically, even though a lot of times it's around women's cycles or it is cyclical, I don't go there first, because we've got to clean up a couple other things. And to your point, the whole system has to be functioning well. And sometimes we see those improvements even with what we're doing neurologically, because a lot of what we're doing is working on their autonomics. And I know we talk about this a ton just because of our patient population, but then you look at that extension through the hypothalamus into their endocrine system and what is happening with their hormones. So sometimes we see that even regulate without having to do anything to their hormones, because in reality, your brain's controlling a lot of that.
Exactly.